Gender-Based Medicine by Michelle Erickson. In today's presentation, we will elaborate the need for gender-based sensitivity in today's healthcare settings. Today's audience will be ED and acute care nursing staff, Mr. Rooster will be the lecturer who will provide an educational lecture in a classroom located in room 101. First, to identify sex versus gender. Sex is the hormonal or anatomical parts an individual possesses. Gender is the individual's identity based off of cultural perspective, based on individuals' preferences, desires, lifestyles, presentation, and identification. Challenges in healthcare scenario. In today's scenario, a patient presents to the ER with stroke-like symptoms and sudden urinary incontinence. Mark, the patient, is terrified, crying, unable to fully express his words. Tom is assigned to be his ER nurse. Upon meeting, Mark sees Tom, his nurse, and becomes visually upset and wants to leave against medical advice. The nurse does not understand what is wrong. He educates the patient for the need to stay and have a full workup, an EKG, a head CT, possibly a urinary catheter, medication intervention, possibly needs to be life-flighted to a higher level facility to care for him. The patient begins to cry and hyperventilate. The nurse tries to lean him back to assess him and help him with his breathing. The patient screams, "No, get away from me. Get me another nurse. I want a female." Tom doesn't understand what's happening. He goes to his provider and states the patient's unable to allow him to assess him and is requesting a female nurse. A female nurse enters the room and the patient begins to calm. After further investigation, the female nurse realizes that Mark is a transgender. He dresses as a male, identifies as a male, but under his clothes, he is perceived with female parts, breasts, a vagina. He was very upset and didn't want the male nurse to see his female parts. The patient believed that Tom, the male nurse, would be perverted and see his female parts in a way he didn't want him to. The female nurse tries to soothe the patient and educate on the need to treat all patients equally and that there is no bias against him from the other nurse. She reiterates to him that no matter what an individual identifies as, we as healthcare professionals must understand that anatomically, signs and symptoms will appear different and require different treatment modalities, interventions, but we must treat the patient with respect while providing appropriate treatment and still preserving their dignity, their sexual orientation, and lifestyle choices. The nurse remained very matter-of-fact, provided education on why we had to do the things we had to do, and explained exactly what she was doing with no surprises. She elaborated that a patient presents with a medical problem, and as a male or female, this presentation may be different. Mark understood, and he later apologized to Tom, his male nurse, for the misunderstanding. In this scenario, we can see that there's a couple biases going on. That one, male nurses seeing females might have some perverse. This is not true. All nurses should be treated equally, and if it's for the comfort of the patient, they have the right to request another nurse. This scenario also had bias against a transgender. Mark identified as a male, however had female parts. This situation must be presented with sensitivity and respect to instill dignity in the patient. As healthcare professionals, we must educate our patients, we must educate our peers, family members. We must provide advocacy for those with gender-based differences. We must promote equality for all patients, provide a safe environment where they can speak freely. We must reduce the negativity that is the stigma with many gender-based issues. We have one goal, to provide the best patient care possible. As healthcare professionals, we know that is our main mission. Some new gender-based cultural approaches for those working in healthcare can include additional educational training, health streams, workshops, live or web-based seminars with guest speakers who have more information readily available. Role play could be used to reduce gender-based barriers. Alternative therapy workshops, skills fairs may be provided for staff that is interested in furthering their education on this matter. Education for new drug developments for transgender individuals. Clinical procedure modifications for those with different presentation than what they have anatomically been given. Our overall goal is to improve the health, safety, and well-being of lesbian, gay, bisexual, and transgender individuals. We must provide unbiased, equal care for all. Also, to resolve stigma, male versus female providers. Providers are there to do simply that, provide care. We need to remember that it comes from the heart. Whether male or female, providers just want to do the best job possible and provide the best patient care possible. Today's lecture was provided with reference from Helio.com, Nursing Journals, Gender-Based Barriers for Male Students in Nursing Education Programs. Also, HealthyPeople.gov 2020, Lesbian, Gay, Bisexual, and Transgender Health. Also in reference was our course textbook on Being Different, Diversity and Multiculturalism in North American Mainstream. Thank you.